Thank you for trusting us with your upcoming surgery. We'll do everything we can to make sure you have a good experience, starting with this video to help you prepare for surgery. By following the instructions in your patient packet, you can help ensure you have the best outcome after your surgery. The information includes advice on diet, physical exercise, smoking cessation, respiratory exercises, required lab tests, and infection prevention practices. Please remember, your cooperation and willingness to follow these recommendations are important for a positive surgery experience.
Your body needs fuel to heal, so it's important you make sure you're getting all the nutrients you need to recover fully. Eat balanced meals of whole grains, fresh fruit and vegetables, and lean protein. Eat modest portion sizes. Eat until you're just satisfied, not stuffed. Make sure you drink enough fluids. Most people need at least 6 8-ounce glasses of water or other healthy fluid per day. However, check with your physician if you're on a fluid restriction. 1 week before surgery, stop taking all nutritional supplements, including vitamins and minerals. Unless otherwise instructed by your surgeon or anesthesiologist, please do not eat anything after midnight prior to your surgery. On the day of surgery, take your medications as instructed by your physician with a sip of water. Do not eat or drink anything after arriving at the hospital.
The stronger you are going into your surgery, the better. It's important to be active before surgery to help strengthen your heart and lungs, as well as your other muscles. Being active before surgery can help decrease post-op complications and will help you come out of your surgery feeling better. If you are currently not able to walk, follow the chair exercise handout in your packet. If you can walk only 1 or 2 minutes at a time, then follow the modified home walk program. If you can walk more than 2 minutes at a time, then follow the active home walk program. It is important to listen to your body during any activity. Duration is more important than intensity, so walk at your own comfortable pace. Your physician will help you decide which exercises are right for you, both before and after surgery.
After your surgery, it will be very important to make sure you are breathing deeply to prevent any complications with your lungs. You'll be asked to use a device called an incentive spirometer to ensure that you are taking deep breaths. This device measures how deeply you can inhale or breathe in, and it helps you to take a slow, deep breath to expand and fill your lungs with air. This helps prevent lung problems such as pneumonia. Detailed instructions are in your packet, and your nurse will help you to learn how to use the device. This is one of the most important things you can do while you are recovering from your surgery, and it is easy to do. It's also very important to refrain from smoking before and after your surgery. Sit up straight as possible. Do not bend your head forward or backward. Hold the incentive spirometer in an upright position and place the target pointer to the level that you'll need to reach. Exhale or breathe out normally and do the following. Put the mouthpiece in your mouth, close your lips tightly around it. Do not block the mouthpiece with your tongue. Inhale slowly and deeply through the mouthpiece to raise the indicator. When you cannot inhale anymore, remove the mouthpiece and hold your breath for at least 3 seconds, and then exhale normally. Repeat these steps 10 to 12 times every hour when you are awake, or as often as directed. Here's a demonstration. Keep a log of the highest level you are able to reach each time. This will help the caregiver see if your lung function improves. Also, a very important part of your recovery exercise is to cough after your deep breaths. To make this easier, you will need a pillow. You'll place the pillow over your incision site, squeeze tightly, and then cough.
Another key way to keep you safe is to make sure everyone who takes care of you has a complete list of your medications. Be sure to include prescriptions, over-the-counter medications like vitamins, minerals, and pain relievers, inhalers, topical creams and ointments, patches, eye drops, ear drops, nose drops, and injectable drugs like insulin and implanted pain pumps. Include how often you take it and any other special notes. Check your list several times before surgery. A form is included in your packet to make it a little easier. We also need to know about all of your allergies and intolerances. Be as specific as possible, listing the medication and reaction you experienced. This helps us make sure we don't give you anything that you're allergic to while you're in the hospital. Many of your medications may have special instructions about when to stop taking them prior to surgery. Your physician or a scheduling nurse will give you specific instructions 1 or 2 weeks before surgery. Don't bring any of your medications to the hospital with you. Everything you need will be provided here. See your packet for 2 exceptions to that rule. When you go home, you will be given detailed instructions about which medications to take. New ones may have been added, others may have changed. Ask questions anytime throughout your stay if you don't understand. Finally, it is often helpful to have your new prescriptions filled before you go home. For your convenience, Munson has a discharge pharmacy located below the main lobby, and your nurse can help you have your prescriptions filled before you leave. There are several nearby pharmacies as well.
You play a significant role in reducing your risk of surgical infection. Following a few simple steps before and after surgery will go a long way in reducing your chance of infection. Before surgery, please read the information packet that has been given to you. Follow the directions you have been given to use the chlorhexidine wash. Do not shave your surgical area. Make sure you clean under your nails with the nail brush that has been given to you. Brush your teeth 2 times every day and use the mouthwash the day of surgery. After your surgery, the single most important way to prevent infection is to wash your hands. You may use soap or water or hand sanitizer. Wash your hands before and after eating, using the restroom, or touching animals. Ask your visitors to wash and disinfect their hands before touching you. Don't touch or scratch your incision. If your dressing becomes wet or soiled, please tell your nurse. Staff will sanitize their hands each and every time they enter your room. If you don't see them do it, it's okay to ask or remind them to do so. After you leave the hospital, follow your surgeon's orders for taking care of your dressing. Look at your incision site with every dressing change. If you see any cloudy drainage, redness, or increased swelling, call your doctor or home care nurse. Call your doctor if you have a fever higher than 101 degrees. We want to keep you safe from any kind of infection that might prolong your stay or make you come back to the hospital. We wish you a speedy recovery. A few simple steps is all it takes.
One more thing. If at all possible, please bring a family member or a friend with you to the hospital to support you on the day of your surgery. We hope this information has been helpful. Please contact your surgeon or primary care provider if you have any questions. You are an important member of your surgical team, and how quickly you recover depends a lot on what you do. Please spend some time looking through the packet of information you've been given. We look forward to seeing you soon.